Good afternoon ท่านอภิสิทธิ์ เวชชาชีวะ the former Prime Minister of Thailand. And I would like to say good afternoon to everyone in this event as well. Welcome to the general Q&A session. I am Thawar Butjan, the co-founder of this event and in charge as a moderator in this Q&A session. Apart from those two interesting topics that the former Prime Minister has shown us his vision, we have set up the vote regarding the participants would like to ask Mr. Former Prime Minister. So let's start with the highest rank on the question. So the first one, if you are the current Prime Minister, what would you do differently from the past to the next 10 years in order to make it impactful and meaningful?
I think my biggest concern at the moment in the country is that there is a gap between the younger generations and the older generations, with so many conflicting visions of what they want from the future. And I think one of the first things that needs to be done is to create a space where both generations can be brought closer together to understand each other, right? And from there, I think what I've said in the last two sessions concerning making sure that our approach to policy takes a holistic view and that our public sector is restructured to be service-oriented, providing the necessary welfare, be more decentralized, engages more stakeholders in society to participate, would then be key to driving changes for the next 5 to 10 years. But I think we badly need space for dialogue of those who have different visions of where we want to go. Otherwise, I think it's going to be difficult to try to push one way or another, because we just get stuck in the kind of situation we're in now.
All right. I would like to add a little sub-question to the same whole topic. You've mentioned about the reconstruction of the Thai public health. Well, so I would like to ask if you have the authority to change or to improve the Thai healthcare system, what would you do?
That there are a number of challenges at the moment. I think the health coverage system is often underfunded, right? And I think apart from being underfunded, you have to recognize that in health, the expectations of ordinary people about what they see as basic services is not static, all right? Many procedures that were seen as luxury in the past is now seen as necessary. And when it comes to matters of life and death, it's very difficult to convince people that this is not for you. It just cannot be done. So we have to make sure that both the universal health coverage system, the social security system, if it's not going to be integrated into this main system, is adequately funded. And to do that, I think it's important to do a couple of things. The first is that the allocated budget must be guided by a formula that is scientifically based. And we must try to reduce discretion as to how much or how little the government this year or next year we want to give. All right, so we have to make this calculation as automatic as possible to make sure it's adequately funded. The second thing is we need now, and the second thing is the cost of healthcare personnel should be separated from the funding of coverage for people accessing healthcare. that will help to make sure that the medical profession and the health services staff who are very stressed in their jobs now get a fairer deal. I mean, I've seen the numbers concerning the hours worked by nurses and so on. It's incredible. It just isn't fair, and we need to make sure that they are adequately compensated for what they do. The third thing is we should now move to a more detailed, if you like, healthcare services for particular sectors. All right. So, for instance, we should now be targeting the health of children to be born, which is to say we have to give the rights to pregnant women to have access to certain things to make sure that the child is born healthy. All right. So it's nutrition, iodine, or whatever. Issues concerning reproductive health on the part of women, and also rights to have testing and monitoring, so mammograms, to detect cancers and so on. These we need to be more detailed now. We need to be more, if you like, responding to the various niche demand of particular groups. That should be the next stage of the public healthcare system. We need to sort out the mess in Bangkok as exposed by COVID to have a more unified system, and where I think private hospitals have to play their part in a more equitable fashion when there is a crisis or a pandemic like this one. And again, strengthening what was already a success in the past concerning preventive healthcare, and engaging people as part of the healthcare process. The healthcare volunteers, given the new challenges that are coming up, they will need to be used to take care of elderly people who are not going to be looked after in hospitals, but in their communities or on their beds in their homes, much more. There will be a huge demand, increase in demand for that as well.
Well, thank you. I hope that by separating the fund of the medical personnel, that would fix the problem of the delay of the salary for the medical workers that we're currently facing right now.
Yeah, I've been trying to get to the bottom of that because I've heard some complaints, and I've passed this on to the health ministry, but they were saying that it shouldn't happen. But
all right. Okay, let's moving on to the next question. The second runner-up. Again, if you are the current Prime Minister of Thailand, what is the strategy in order to open the country?
Right. I think we are already opening up. I think we have to set clear criteria, and in doing so, we need to consult all the stakeholders and try to reduce uncertainty and inconvenience as much as possible. I'm just surprised that the government thinks that you can change the rules about people traveling in and out and expect travelers to be able to do that within a day or two. That's not how people plan cross-border travel, and I'm just surprised that doesn't seem to be factored in. I would then have maybe even separate and clear criteria depending on the countries we're dealing with, because the situation in various countries differ enormously. And in terms of trying to get our tourism income back, the biggest challenge is the fact that before, China made up a third of the number of visitors. but she has no intention at the moment of opening up. And if I were Prime Minister, I would move pretty quickly to talk to them about, hey, maybe you want to try a travel bubble with us, because your people want to come here, and our people want to go to China, and see what kind of measures that they would demand, and see if we could accommodate. Well, because if everybody is back except China, we would still only be 2/3 of a way of getting things back, right?
Yeah, I agree with that. All right, let's move on to the last question.
And sorry, before we talk about the travel rules, the most important thing is to make sure that people see that it is safe to be here. Exactly. And therefore, making sure that the infection numbers don't just keep rising, and creating trust with the numbers, which is being more transparent, and doing what I suggested also earlier about providing details about the profile of people who are hospitalized and who become severe cases.
I'm totally agree with that. People need to earn the trust that they will be here and safe without getting COVID. Okay, now let's move on to the last question. But in order to do that, I would like the speaker who asked this question. The question is about how to apply digitalization to public health, similar to the successful Taiwan. I would like to ask the audience to ask by himself directly to you. All right, just give us a minute.
Hello. Yeah. I was just asked for, as Mr. Patrick has said earlier, I was asking about the visualization of the public health, and see how it could be done successfully, similar to Taiwan.
Okay. Right. I'm not sure I got everything because the sound was a bit uneven. This is about the.
I think he said that how would digitalization be implemented into the medical field?
The implementation of
the digitalization.
Okay.
Yeah, the information.
Okay. Right. First of all, obviously you need the infrastructure, and I believe that the situation there is not so bad, but we just have to make sure that in faraway rural areas there is adequate infrastructure. And I would argue that the regulator of the telecommunications sector, which should have a sort of equalization fund, if you like, where they have money from the licenses, should be contributing more to investing in infrastructure in places where that's still lacking. That's the first thing. The second thing is obviously to train people to be able to use these tools, telemedicine, and I think it will help tremendously, because I know that we've experimented in many areas where you can have patients or people coming in and consult doctors that are in the big hospitals in town and cities around the country, but it needs training, right? To make sure that runs smoothly. But apart from that, I mean that's just a sort of access to some basic services using technology as a facilitator. But there is so much more that we can do with digital technology in health, and that requires, I think, the key thing is how we manage health data, right? So if we have a clear set of rules about who collects health data, who owns that health data, who can access and use that health data and in what form in order not to violate privacy, and then use that to provide better services. I think it would be a tremendous boost to the quality of healthcare. And it's not just a question of providing care. You know, with big data, we should now be able to identify the state of health of people in the various localities. So we can, for instance, get to some diseases that more Northeastern people appear to have than the rest of the country, and begin to make sure that there is adequate services to combat that, as well as beginning to look for why certain diseases are prevalent in the Northeast and why some are in the South and why some are in the North, using big data and the set of rules that I said need to be put in. Because at the moment, the public sector is failing at making use of big data, because each department is still not sharing data with other departments. And it's as if data are owned by departments, not by the government.
All right. I think the reason is it is because there is no trustable medium to connect between each department.
Well, no, there's a legal problem, because most of our laws will specify which department or which ministry is in charge of this, and the data that they collect can only be used for these purposes, which is why I say we need a different law to set out the rules about who can access and who can use data, obviously with the view to making sure that there is no violation of privacy.